This is for people with like severe lower back, disc herniated stenosis, facet arthroscopy, joint problem, degenerative, like causing severe lower back pain going down to their legs. This video is for you. Okay, so the first question I ask is that 80% of my patients that come in with a low back problem, serious back problem, I can guess 85% of the time, and I am correct. The true level is going to be at the L4, L5, and L5S1 herniated disc, bulging disc, stenosis on those areas. So the first question is that why at that area? We go over that in more detail. Like conventional way. What is the conventional way of treating back problem? First, give you some steroid injections. Okay, give you some pain medication to numb it, and then it's not working, and then injection, and then final time. A lot of people, why did they get surgery? No one wants surgery at all, but to a certain point, the pain is excruciating. The people are begging for surgeries because there's a lot of pain. Okay, and people doesn't want surgery, but they have to do it. Okay, so that's the conventional way of it. Is medicines, injection, and surgery. And a lot of times surgery can prevent it if you know the right way of fixing the problem. So the first question is that why is that L4, L5, L5S1 has so much degeneration? Why we need to solve that problem in order to fix the disc issue? Okay, so I want to introduce you. It's all about system. You have a system of determine how to fix the problem, how to fix the lower back problem. So I want to introduce the 4 steps to solve a chronic pain or chronic condition. So first thing that you need to do is that identify the problem. How do you identify the problem? Is your pain, okay, verify with what? MRI, okay, that's why we know, or X-ray, that's why we know it's L4, L5, or L5S1, degenerative, stenosis, bulging disc, herniated disc. So we need to identify the problem. Now the second to solve the problem is to understand the knowledge about the problem. What are the underlying causes of the problem? Just don't deal with the pain. Just don't deal with the symptoms. Why degenerative at the L4, L5, and L5S1? Why is that herniated? What's the cause of it? So we need to go and dig down to the root cause. That's what the doctors have to do, and fix the problem and prevent it from coming back. That's what the doctors have to do. Find the mechanism and the knowledge of understand where is the problem and fix it. How do you fix it? The solution, number 3, is the solution. How do you fix the body to heal the problem, the pain? Okay, so that's the way. So this is I always want people to understand this. So first question I ask is, if you have a chronic pain, why do you have a chronic pain? Why do you need to come and see me rather than your doctors? Because it doesn't work. Most of people said it doesn't work and I'm getting worse. I don't have the solution to it, so they come and see me. So the first question I already asked them is, do we have a healthcare system or sick care? What's this sick care system is good for? The model that we are having, that's why medicines is good to save lives. The model is for acute problem. Band-aid the problem, acute problem, it works. But you cannot use the Band-aid models, acute model for a chronic condition. If you have a low back, it's already for more than a month, it's already chronic. So how do you fix the chronic condition? Is the body. Fixing the body so the body can repair. That's the best way to fix the pain that you are in. Okay, so understand the solution. How does the body heal itself? What kind of technology that you can introduce so the body can promote the healing from the body from within? So that's what we are looking at. How to heal the body from within. Number 4, now you know the mechanism of the body and you know what's the process of the body. You know how the body works, how the body heals itself. So what you have to do, just do it. The consistency that counts. Okay, so I will go over more what's consistency. You have to know the mechanism of the injury. Now you have to be consistent doing the right thing, the right exercise, the right things that were not aggravating the problem, and consistent doing on it so the body can heal. So let's go over this again. First, identify the rate of problem from the symptoms. Find out what's where the problem, understanding the mechanism, understanding the where the problem come from, more knowledge about where the pain coming from, solution, and just do it. Okay, L4, L5, L5, S1 has the most common. I can guess 80% of the time that people come in are at those two levels. The first question is why is it that level? So this is the pictures of an MRI. This is the bone, and this is the disc. You see this right here is white, and now this is dark, and then you see there's not too much of bulging, but there's a bulging herniated disc at this level, and also this is L4, L5, bulging herniated right here. So why are those the most common? Because that area takes the most loading. People have bad posture. That's more loading onto that area. So we need to take a look from posture-wise, from the foundation, which is the feet, all the way up to the brain. Okay, so we have to look at, and this is the pictures of X-ray bones, and the disc space is good. This is a foraminal, is big and thick. Look at the L5S1. Compare the disc, and this is a lot thinner. So why is that? The question is that why is that area that has the most degenerative? We need to find out the cause of the problem and fix it, and find out the cause of the problem and prevent it from coming back. So that's why the first thing is that identify the problem. We know that from the MRI, the X-ray, that there's stenosis. So there's a disc problem, okay? So there's a problem in this, and follow the symptoms and chase the root cause. Why it has the most degenerative at that L4, L5 level. We need to ask a lot why to understand where the problem comes from. So we have to fact check from the foundation on up. So it's not just about the back end, to fix the back and leave everything alone. No, that doesn't work. You have to do what? You have to check where does the cause. Can the cause from the back? Can this cause from sitting incorrectly, or cause from the gait, the walking? How about the brain? Okay, how about the brain that can cause an issue? Okay, so like if you have chronic pain, like going down to your right side of the leg, does that affecting the left brain? Chronic pain can lead into brain issue. So we need to understand that, because the left brain controls the right side of the body. Okay, if you have both, then both sides of the brain is overstimulant, because pain is stimulants. Okay, so we need to recognize the brain is the part of the issue. How can you fix the brain? What are the ways that we can fix the brain? When you fix the low back, the key thing is fixing the back and fixing the brain and fixing the gait. So we need to find out where is the problem. Do you walk with a limp? When you walk with a limp, there's more pressure, right? Can that be putting pressure, more force, more weight bearing? Can that cause back problem? So we check from the foot, ankle, knee, pelvis, low back, posture, and all the way to the neck and to the brain. So that's the way that we have to take a look at the problem. And solution. Now you know that the herniated disc. Now we know the mechanism of the issue. Now how can we speed up the healing so the patients can minimize the pain? So technologies. We have technologies to specifically to deal with the problem. So we understand that this is a herniated disc. There's a disc problem. What's the best way to fix a disc? Okay, so that's why we have technologies, the non-surgical spinal decompressions. Okay, what does this do? It's distracting. The distracting force is specifically dealing with the disc. And there's also PMF. What's the purpose of PMF? Pulse electromagnetic field. Using magnetic field energies. To do what? To promote the body to heal itself better and faster. That's what we want. When you're in pain, you want to get out of pain ASAP. So we have technologies. Lasers speed up the healing, increase circulation to that area. Fibroculture, there's a lot of scar tissue that restrict you from movement. Okay, the brain can restrict you from movement. Scar tissue built up on that level can restrict movement. So we need to break that scar tissue out. Alignment of the spine, from the back all the way up to the neck and also the brain. It's a whole system that we are fixing. Education and make an easy way to rehab. So you need to rehab that daily. Consistency counts. You have to do it like every half an hour to an hour to continue to introduce more movement. I designed the exercise with 2 pumps specifically to deal with the herniated disc. So patient need to be understanding. So now our society, what happened? There's a lot of information. Okay, we just fix the spine, fix the spine, fix the spine. No, not only we fix the spine, we have to reducing information. I find out there's a lot of information that's causing from the gut, digestive tract. 80% of the immune system is in the gut. So we help to supporting the body to heal better by teaching, by educating the patients how to reduce inflammation. The first system that we look at is the digestive tract, which is the gut. So when you're reducing inflammation, now you have the raw material to fix the problem, fixing the pain. So it's more than just fixing the low back and leave it alone. No, we have to deal with the whole body, the whole system. That's how the system of the body, so that's how we fix the body from inside out. So now you know the mechanism, so what do? You just have to do it. You have to do it. Okay, so just do it by applying the right things, fixing the posture, doing all the movement so that your body can now function better and the body can heal itself. Okay, so that's the 4 ways that I introduced to fix the chronic condition. In particular this time is the lower back. So now, how to get a hold of us, to get an examinations, call us at this number, 925-999-8806, 925-999-8806. Thank you.